Hello, welcome to the webinar. We're just going to give attendees just a few more minutes to join. So just hold tight and we will start in about 2 or 3 minutes. All right, we're going to go ahead and get started. Good afternoon, and of course, good morning for any attendees on the West Coast. Thanks for joining the webinar around best practices in telehealth grant seeking. We are extremely excited to be collaborating with professional grant writers to help share some tips and tricks when responding to telehealth grants. My name is Alex Donini. I am the Director of Marketing here at Iris Telehealth, and my co-presenter is Marion Chambers, grant writer at Professional Grant Writers. As many of you are most likely aware, there's been a surge of telehealth funding opportunities sparked by the recent pandemic. If you're looking to expand your current service offering or implement new services, grant funding can be a great way to get jump-started. Just a little bit about Iris Telehealth. So we were founded in 2014. We are a telepsychiatry partner for community health centers, hospitals, and health systems. We have 120 plus psychiatrists and psych NPs. We are founded and currently led by psychiatrists and also Joint Commission accredited. If you want to learn more about Iris Telehealth, you can visit our website at iristelehealth.com or email info@iristelehealth.com. I'm now going to hand the mic over to Marion so she can share her experience around telehealth grant seeking. Marion, take it away.
Thank you very much. Appreciate the opportunity to be here. I am one of the grant writers for Professional Grant Writers, which was founded in 2009. Professional Grant Writers has worked with numerous hospitals, public health centers, and other healthcare providers. We have a full spectrum of services, which include helping our clients identify grant opportunities. We work with our clients to write and package grant applications. We assist with submissions, and we help every client develop long-lasting relationships with grant makers. If you would like to learn more about Professional Grant Writers, please visit professionalgrantwriters.org or email Megan Hill, or CEO, at megan@professionalgrantwriter.org. I have personally been writing grant applications for over 2 decades, and during that period of time, I've helped my clients to obtain over $180 million in grant funding. Additionally, I've been part of grant writing teams working as a writer or reviewer, and in that capacity, I helped procure an additional $13 million for projects. My heart absolutely lies with the type of work that all of you do. I am born and raised and still live in Appalachia, so I totally understand the need for the types of services that you are providing. I have worked with FQHCs. I totally support and understand the work of community mental health centers and community mental health providers. I have worked extensively with a number of different mental health care providers, including a 139-bed skilled nursing facility, which provided services for memory support. And I also worked with a former state-run facility. It was a hospital that now specializes in working in mental health and PTSD, and they also do a lot of geri-psych. I work quite extensively with providers who work with people who have co-occurring problems with mental health and dependency issues. So I really hope this presentation is going to resonate with your needs, and please know that if there's anything I can do, to help you to get the funding you need to meet your vision, I really want to be as supportive as I possibly can. Okay, could we go to the next slide, please? Okay, the first step in the process is to make a determination if you have a need for grant funding for telehealth. First, you should consider anecdotal evidence. Talk to your peers, talk to your competitors, get testimony from people who are using it, find out what's working and what's not working. Next, and this is incredibly important, start to assemble quantifiable evidence that might support the need for telehealth grants. Look at data on underserved and unserved populations. Do you have lists of people who are waiting to get appointments? Do you have documentation that shows that you have significant numbers of patients who are non-compliant with their healthcare planning because they are unable to access their appointments? Are there other sorts of documentation that you could gather, such as financial documentation, indicating that your profitability is being reduced because you're not providing telehealth and your competitors are? Could that potentially affect your sustainability? Also, look at the way you provide healthcare and compare that to evidence-based data for best practices in your field. Okay, next slide, please. Now that you've made a decision that you do need to have telehealth grants, you need to develop your overarching project goals. Look at anecdotal and quantifiable evidence. Evaluate it based on what you want to achieve. This information is going to inform your selection of the type of telehealth systems you need, and it's going to provide the foundation for the development of successful grant funding. Then get input from the stakeholders who are going to be part of your system. Talk to the people who would be using it. Who's the client base that you serve? How comfortable are they with using technology? Generate buy-in from your clinicians. This is critical. You really need to talk with them at the onset to find out what they need, what they feel comfortable with, and what types of systems they feel would help them to meet the needs of the service population in your system. Then look at your organizational plan. Try to determine what resources you have. Be very realistic. Do you have capacity to implement a telehealth program? Are additional people going to be necessary? Finally, meet with peers and again, get recommendations with the ideas that you have and see how that aligns with what is being successfully used in your area. Next slide, please. Now you need to identify potential funding sources. Currently, there are 19 active programs and there are 66 inactive programs. A lot of these programs identify special populations. So you want to be very strategic in selecting opportunities that align closely with your demographic group. Then consider opportunities that align with your geographic areas of interest. Finally, determine which telehealth programs are recurring, which ones are single offering opportunities. Look for promising programs that are both current and pending. You want to include every opportunity that could be an effective way to finance your program. Okay, next slide, please. Consider the past funding patterns of every grantor that you are looking at. Look at their award ceilings and floors. Select funding that aligns with your needed budget. And then consider when is funding going to be available. Try to align their timeline with your anticipated needs. Okay, next slide, please. Okay, there are 4 different types of telehealth initiatives for you to consider. You absolutely should look at all of them as part of your overall plan. First, corporate grants provide smaller awards. They often limit some of their funding to those areas where they have operational sites. This could be wonderful if you happen to be located in some of those areas where corporate grants are focusing their funding. Second, look at foundation support. Foundations will operate on a smaller level, but there also are regional and national foundations. They also vary greatly in award size, and their areas of interest are typically determined by the changing interests of the board members. There generally are state grants that are out there that are geographically limited. They are always less complex to seek and manage than federal awards. Finally, the largest awards are going to be provided at the federal level. They're generally available on a nationwide basis. However, there are federal awards that are geographically limited. So you want to determine what federal awards you're going to seek and try to align the total package of corporate, foundation, state, and federal funding. Now, the federal funds are the most complex to apply to. They are also generally the most complex to administer. I will help you find ways so that you can plan for a successful federal submission without creating cumbersome problems for your organization in the development of a successful proposal. Next slide, please. Okay, you want to look at current and pending programs. Current programs are those that are open until the announced submission deadline or have a rolling submission policy. Pending submissions are not currently open, but for many of the pending submissions, they're recurring. And you're going to hear me talk often through this presentation about the distance learning and telemedicine program. When many of these federal programs are announced, they have a recurring application period that generally happens annually, and it's generally during the same time of the year. Distance learning and telemedicine had one change where they took applications twice, and it was in 2020 in response to the COVID-19 pandemic. But pending opportunities are things that you can plan for. And when the windows open for your actual submissions, they're often quite short. So you want to know in advance which pending submissions you are interested in seeking, and you can apply in advance or get a lot of information together so that when the window of opportunity does come open, you're going to be ready and you can really focus in on those changes that are going to be occurring between previous applications and new announcements. Okay, next slide, please. Okay, you want to use a timeline to optimize your limited resources. All of you have other things that you're doing, and so you need to strategically plan how much time you can allocate, and that may vary through the course of the year. You also want to align your planning availability and time with all of the deadlines for submissions. Secondly, consider all telehealth funding opportunities. As I indicated, there are multiple opportunities from a variety of sources. You want to make sure that you're getting every dollar that you could possibly get for your project. Number three, develop a submission plan that's aligned to your implementation needs. Some of the funding programs might have a once a year application period. Then they may take 3 to 6 months to make decisions, and then maybe another 2 to 3 months after that for contracts. So you want to make sure that your submission plan is aligned to when you need telehealth. Finally, prioritize programs that are going to be reviewing on a rolling basis. Try to determine when you can actually put all of these things together for a plan that's going to work for you. Okay, next slide, please. You want to look at pending programs, again, distance learning and telemedicine and others, and try to plan for project matching requirements. Look very critically at what they've had in the past. Now, that's not always a predictor of what's going to be required for future submissions. They do change from one year to the next. But if you know that there are programs that have historically required project matching, you want to talk to the people in your organization, because you will be asked to provide information on a letterhead signed by the person who is available and authorized to commit money, indicating that matching money is number 1, available, and number 2, readily committed. Number 3, consider leveraging multiple grants for very large telehealth projects. Number 4, continue to collect anecdotal and quantifiable support. You may want to get some third-party documentation. For example, if you are working with large populations of homeless people who are in need of mental health services, you may want to meet with some of the providers or some of the human service agencies that are servicing your population and get verification from them about what services they need, and verify that you can put this into your application so that it's going to make your application stronger. Then prepare for application requirements. Make sure you're going to have a DUNS number, make sure you have a SAMS number, make sure your financial statements are up to date and ready for submission. All of these little housekeeping things are necessary. They can be done in advance so that when you're ready to submit, all of those things are good to go. Finally, review previously funded initiatives. That's not always available for every funding source, but when it is available, it's a powerful tool for you to use to get an idea of what that particular grantor considered important, and it can help to inform the development of your project. Okay, next slide, please. Okay, to plan for your submission, you want to create alignment with grantor priorities. Every grantor, whether it's a foundation, corporate funder, or state or federal funder, they have specific goals that they want to achieve. Now, your program has many attributes that it's going to bring to the people that you're serving. Try to determine by reading historical funding patterns, notices of fund availability, as much documentation as you can about each program to try to determine what their goals are. Then look at your program and try to create alignment. Secondly, create a compelling narrative and back that with quantifiable data and third-party verifications. Narratives are so important that in this presentation, they're going to have a slide of their own. Next, use evidence-based practices. In telehealth, more than any other program or any other field of program funding that I've seen, they want evidence-based practices. So they're not looking for you to take equipment and use it in a way that's, something that's really outside of what has historically been proven to be successful. They know that there is a need and they want you to take the funding, and you may have to pivot previous usage somewhat to meet the needs of your service population, but they want you to stick to what works. So you need to research what works. And again, that's going to be, reading about what's current in your field, talking to peers, looking at what competitors are doing, and you want to demonstrate that you're going to be following a particular pattern that has evidence of success. Then create measurable outcomes for assessments. You want to loop that into what your need is. So say, for example, you have demonstrated need that you have a significant part of your service population who's not complying with their healthcare planning. Perhaps they're missing appointments. Maybe they live in rural areas. Maybe there's a lot of low-income people who don't have private transportation, and public transportation is inconsistently reliable. You might want to build in some measurable assessments to demonstrate that your anticipated outcome of long-term compliance with healthcare care plans is going to be enhanced through the use of telehealth, and indicate how that data is going to be quantified, where you're getting your baseline data, and who's going to measure that data. Next, develop a realistic budget. This is a process. You want to know what you're going to be needing, and you need to know be very realistic about your organizational capacity. And again, we're going to be talking about budgeting more in depth in later parts of this presentation. Then address sustainability. Every single telehealth funder knows that there is, an anticipated lifespan for the equipment that you're going to be getting. They know approximately how long that equipment will be or should be in operational use, even with optimal maintenance. So they're going to want to know, how is this program going to be sustainable? And there are a number of things that you could do to demonstrate sustainability. Number one, you might want to mention that annually money will be budgeted to purchase or upgrade telehealth equipment. Number two, you might talk about new lines of funding that you're going to seek, whether that's going to be doing some fundraising efforts, getting private commitments from other sources, looking at new grant opportunities, perhaps billing insurance companies. So you want to show that if they invest money in telehealth funding, the telehealth is going to be embedded in your continuing operation, even at the conclusion of this grant period. Okay, next slide, please. Okay, your application timeline is a powerful tool that you're going to use that's going to help you through every proposal that's prepared, and it's going to be critical, especially when you're working with federal programs that are quite lengthy. Specifically, I'm going to again refer to distance learning and telemedicine. That program, the application instructions sometimes range between 150 and 180 pages. There are programs that have more than one document, and you have to comply with the provisions of multiple documents. And for someone who is in a position where they're also doing other things, providing care, providing administration, doing operational support, the need to look at these documents can be absolutely overwhelming. This is where a lot of nonprofits and healthcare providers lose commitment and interest because clinicians are busy providing care. Administrators are often just overtasked with general operational functions. So by creating a timeline, you're going to get buy-in and you're going to get more information for a better product. In your timeline, you're going to have a line that's going to indicate every activity or deliverable that has to be addressed for the completion of this application. Then you're going to have a line that's going to indicate which individual or section is responsible. Then you're going to have start and end dates for the management of each application. And then you're going to be able to take this to your team and show them that they're not responsible for the totality of the project. But perhaps if they are someone who's in the business office, you can show them that they are only responsible for the development of a budget. They are only responsible for, maybe providing data. You might be looking at people who work in institutional research that are going to get you specific quantifiable information. They will know where their obligation starts and ends. Next, your timeline should have you submit no later than 2 days before the grant deadline. If you're looking at state or federal programs, I strongly encourage you to do that far in advance. For federal programs, I actually would encourage you to submit at least a week before the deadline. That's become increasingly important now in the time of COVID. Many people are working from home, and sometimes you have people who are, using their online computers. You've got schools who are now operating online. So the demand on bandwidth capability has become increasingly more significant than it ever was before, and there's limited bandwidth. So you need to be prepared for the probability that it may take longer to submit than it's ever done before. And I want to give you a cautionary tale that I personally experienced, and this is why I spend so much time on it in all of my trainings and presentations. I worked for, it was a community action agency, and I did a project for them for an FQHC application. We had it done several weeks before the deadline, but they didn't choose to submit until the actual day, thinking that, it was something that would be relatively easy. And they had all of the information, and there were just a lot of people submitting. And it took a very, very long time for all the information to be uploaded. They called in their IT support people, they called the agency, and nothing could be done. And it was absolutely horrific because at the time that the grant period ended for the application submission, no additional data would be accepted. That was just devastating. So they called and found that there was nothing that could be done. It just wouldn't be considered that cycle. So they held everything, submitted the identical application, only with updates, in data and financial figures for the next cycle, and it was funded. But please be very aware that these things really happen, and you are so much safer if you submit in advance. Finally, be realistic about the projected time needed to prepare a competitive, high-quality deliverable. It's going to take more time than you think, especially if this is, something that you're not doing on a frequent basis. There are many moving pieces, so allow yourself additional time so that you can really respond and represent yourself in the most competitive way possible. Okay, and I have timelines, a sample timeline for just a federal program. If you would like to see it, please contact Alex and he could share that with you. Okay, so if we could go to the next slide, please. Okay, your narrative is the meat of what you're going to be submitting. You really need to focus heavily on your narrative requirement. This is where you're going to pull in all of this quantifiable and third-party verification, and you're going to tell your story about the need. Now, several years ago, as a matter of fact, as recently as probably the last 5 to 10 years, it was considered to be acceptable to use, just descriptive information, like saying that you're going to be servicing areas of low income concentration, or you have extremely rural areas. No funding agency wants to see that now, not corporate, foundation, government grants, no one wants to see that. They want quantifiable, sourced information. So be sure that you have all of those things. They're appropriately footnoted, and you have references for everything you're using. Again, these are things you could do in advance. You can go to the census site to look and see, as much as you can about your area, but you need to make sure that everything is well documented. Next, remember that grantors receive requests for far more money than they can award. So you need to find a hook that's going to catch the attention of reviewers. I've talked to many reviewers through the years who've told me that literally they get a deluge of applications, and they're all good projects. There's all significant need, but sometimes it's really hard to distinguish one project from another. And you need to make sure that your project stands out. You want them to want to fund your telehealth support. Every one of you have things about your particular project that make it special. For example, and again, I'm going to use distance learning telemedicine. They look at rurality, which is, the population concentrations, and they have mapping and they have census data that they use to provide that documentation. But if there are extraordinary things about the area you serve that support rurality, include that. I recently worked with a client that had some patients who lived in areas that were literally islands, only accessible by boat. So for some of these people, it was absolutely critical to have telehealth available for them. If you have significant health disparities, please go to sources like, Robert Wood Johnson for their county health rankings. Obviously you're looking at healthy people, 2020, 2030. Where are you in where you should be? What are your main health disparities that can be quantified? And then look for other significant program information. I did a lot of mental health, telehealth work with a provider that has a contract with the state of West Virginia for telehealth for the state employees. And some of the clinicians reported seeing an extraordinarily high number of people in southern rural West Virginia who had co-occurring issues with mental health and addiction. So we were looking for additional hooks that we can build in and trying to find quantifiable information to support this anecdotal sharing. And in looking through, some of the research that we did, we found that some of these communities had been assessed by congressional hearings that were done on opioid addiction, and rural, southern, poor areas of West Virginia were declared to be the opioid center of the United States for opioid dependency. That documentation was powerful to put in. That absolutely got the attention of the reviewers, and it helped us with funding. Next, organize your data and organize everything in your narrative according to the application instructions. Make sure that it is very easy for all of the people who are reviewing your application to find everything that they need to see so that they can award points. You want your outline to be the guidance for everything that you're going to be doing. Make sure that you have letters and Roman numerals that mimic the proposal. Make sure that if there's required information, you put it in bold font or underline it or otherwise make it really easy for reviewers. Please bear in mind that the reviewers who look at these are people that are going to be looking at multiple applications, and they often have pretty rigid deadlines about the expectations of how many that they're allowed to, they're supposed to review and time frames. So they may not have the time to go through looking for documentation to award points. You want to make it easy so you get every point that you can possibly get. I know one distance learning telemedicine grant that I was able to get funded was the only one in all of Pennsylvania, Ohio, and West Virginia. And one of the reasons we got funded is because we had the highest rated narrative. And I was so grateful because we had good data, we had a lot of good third-party verification, but it really helped because we made everything very easy for the reviewers to find. Next, make certain that you are presenting a closed loop. You're providing quantifiable information, you're providing third-party verification, you've got this well-documented need, you've got a project that is going to be specifically targeted at that need, you've got anticipated outcomes, measurable ways that those outcomes are going to be assessed. You need to show that you have a closed loop. Verify that what you're proposing to do is going to address the need that you're presenting in your narrative. Okay, next slide, please. Okay, before you submit your telehealth proposal, conduct an internal review to ensure that all requirements have been met. This is best practices. And I do have sample internal reviews for other projects, other types of things for you to look at. And what you want to do is to make sure that all of the statutory requirements, all of the program requirements have been met. Secondly, make sure that all of your documents meet the requirements set forth by the grantor. You're going to have some agencies that are going to give you specifications for font size. They might talk to you about how they want their margins, page limits. Those things are really critical. Some federal programs will tell you that they will only review a specific number of pages. If you go over that number of pages, they simply won't look at everything you submit. You're going to then lose points, potentially lose funding. And you don't want to lose a chance for funding for telehealth simply because you had too many pages, or they required maybe things to be double spaced and you didn't do that. So you want to make really certain that all of the documents meet their requirements. Finally, try to get peer reviews of your narrative. This is really important because you will be so intimately aware of your project by the time you're ready to submit. And you will have worked with everyone in your organization, then you've written this just, well documented application, and you think you tell your story well. But sometimes when you're so closely involved with the program, you may miss things, or something that seems like it's really evident to you may not be as obvious to someone else. So it's a really good idea to have someone else look at this to make sure that the story that you're presenting is truly the story that you want to tell. Okay, next slide, please. Okay, I promised you a slide just on budgets because they are so important. First, look at the grantor recommendation for all expenses. They're going to have ineligible and eligible expenses. Be very certain that what you are submitting follows their guidelines. Second, consider your ability to provide necessary matching money. Don't overstretch. If you're not certain that you can get that matching money and commit it, don't put it in there. Next, make sure your budget's realistic. Make sure it includes everything that you're going to need. These agencies know how much telehealth projects should cost. They will reject budgets that are too high, but they'll also reject them if they're too low. They are literally buying a service. They know what telehealth is, they know the capability, and they know the cost. They want to make sure that you have the appropriate equipment to meet the needs of the clients you're going to service, and they want you to be able to hit the ground running. Next, plan for sustainability. Now, if you're looking at your program, and if it allows things like this, include it in your budget. If not, you're going to be including this in other places, but you want to definitely reflect that you are considering sustainability. For example, if you don't have IT capability to maintain telehealth equipment, then talk to see if maybe including this in vendors might be a way for you to get around this. Secondly, you want to look at the equipment and determine, excuse me, if you have to have technical support. I have worked with clients in the past who built into their budget a line item that provides ongoing technical support, so that maybe they will meet on a quarterly basis with clinicians and talk to them about maybe some of the problems that they might be experiencing, or help them see new ways that they can use telehealth equipment. So everything that you're going to need should be in your budget. And then it goes without saying, allot ample time so that you can go through your organization, because there will probably be multiple people within your organization who need to review the budget and determine if it's appropriate for your needs. Okay, next slide, please. Okay, final review and edits. This is also incredibly important. Make sure all of your documents are well edited. I strongly encourage you to verify all sources of quantifiable data. Make sure that you have that information sourced. Make sure you've got it either in a bibliography or footnotes, so that the grantor can see those easily. Look for simple things like subject-verb agreement. Always try to use active voice. That's just best practices in grant writing. And again, try to make sure, double check that you're doing things exactly the way the grantor wants to see the documents supplied to them. Then assemble all the documents into the required format. Okay, next slide, please. Okay, when you're actually going to submit, you want to make sure that you have someone who's very familiar with technology available to help you. And this could either be someone on call at your IT support, or maybe someone within your department who feels very, very comfortable with this. Last week, I had a submission that was for grants.gov, and it was for a federal program, and they required 25 attachments, but the attachment page only had space for 15. So we had to get clarification. Again, we had to find out what how the funding agency wanted to handle it. And they wanted specific attachments put together in zip drives. So you don't want to be near the end and say run into a situation like that with someone who's never known how to zip files together. Just make sure that you've got someone available for backup if needed. Secondly, give yourself adequate time. Make sure that you're allowing for potential glitches or slow bandwidth, whatever you might be encountering. Third, anticipate long waits for support calls. And this has never been more true than right now, again, because a lot of IT support people at grants.gov and at different agencies are working remotely. So it just makes it so much easier and less stressful if you can build this into your timeline and you plan for a successful submission. Okay, next slide, please. Okay, submitting to multiple sources may be appropriate for you. First, determine if the project aligns with multiple sources. Secondly, verify if multiple sources can use funding to leverage against each other. There are some federal programs that will prohibit you from using their funds to leverage with other programs. That may or may not be a problem, but you want to know that when you're planning your submission schedule. Third, look at timelines. Make sure that the funding aligns in terms of the timeline and project completion period with each source you're considering. Okay, next slide, please. Okay, this is something that no one wants to have to deal with, but unfortunately, it's always going to be a reality. As I mentioned previously, the request for funding in every program exceeds the amount of money available for distribution. So there are going to be times when you may not get funded. When that happens, it's a devastating experience, but you need to use that productively and prepare for other submissions. First, look at the notification regarding the funding decision. Sometimes they will give you reviewer ratings. That is going to be so helpful to you. Don't take that information personally. Take it as a way to learn, make your project stronger. Second, determine if it's possible for you to speak to a reviewer. This is not always possible with every program, but for some programs, they have incredibly helpful reviewers who will talk to you about maybe why one grant was chosen over another, and they can give you a dialogue. That really also helps you, because when those same people who are, looking at future submissions hear you, you're going to be top of mind, and they're going to know that you were interested enough to follow up and make your application stronger. Next, review the types of projects that were funded. Were they different from yours? Was there a different focus? In this time of COVID, there's been a paradigm shift in telehealth. There have been funding sources that have popped up that historically were directed in one area that now are focusing on the pandemic. So try to see, maybe if you didn't get funded, it might be that your project was bumped because there's just been a change related to the pandemic or something else. I've also frequently heard reviewers and an agency say that another factor that impacts getting funded sometimes is geographic distribution. Distance learning telemedicine, definitely, they include that in the information they provide applicants, that they reserve the right to take applications, even highly reviewed applications, and potentially change where the funding is going to go, because they want an even distribution on a nationwide basis. I've been to NSF webinars where they've also said the same thing. If they see a concentration of funding in a particular area, they may distribute it. So you want to find out, why didn't it get funded? And then consider future submissions. Maybe tweak your project a bit to make it more fundable the next time. But don't get discouraged, and understand that this doesn't mean it's a failure. It's simply part of a process. Okay, the next slide, please. This is the slide that everyone wants. You want to know what happens when you get your grant application approved. First, look at the review of requirements. Determine if you've got any special conditions. Second, implement your project on time and at budget. And please remember that future funding is influenced by the performance of this award. And I've never seen that more true than in telehealth, because you may be able to go back to the same funder periodically to either expand your service area or get upgrades in your equipment. Okay, and hopefully you're all going to be having approved projects. Okay, final slide, please, or the next slides. Okay, if you want to look at additional funding sources, you could look at the Rural Health Information Hub. They monthly provide a full spectrum of possible alternatives for funding. I consult this weekly, and it's a wonderful tool. You could look and see where telehealth is. You can look and see what's current, what's pending. Foundation Center Online is another wonderful resource. And then if you have the resources, Pivot. Pivot is extraordinary. It gives you the full spectrum. So these are all really helpful platforms. You can also look at grants.gov on a frequent basis, and that's a really good tool for you to use. Okay, Nick, I can turn it over to you now.
Thanks so much, Marion.
Yes.
And as promised, we have some funding opportunities that we think would be a good fit potentially for CMHCs and CHCs. A lot of information here. I won't read through all of it, and also the slides will be available. We'll send those out after the webinar, most likely tomorrow. So this is one funding opportunity that we found. It's called, it's kind of a mouthful, Digital Healthcare Interventions to Address the Secondary Health Effects Related to Social, Behavioral, and Economic Impact of COVID-19. So a lot of the funding opportunities that we've come across are actually through ruralhealthinfo.org. That's a fantastic resource. You can sort by state, you can sort by specialty. So I would just try to remember that link, and like I said, the slides will be available.
Mm-hmm.
Delta Region Community Health Systems Development Program Technical Assistance. This one's specifically for counties in Alabama, Arkansas, Illinois, Kentucky, Louisiana, Mississippi, Missouri, and Tennessee. And this one's accepting applications on an ongoing basis. That one's also on ruralhealthinfo.org. And then the last one, and Marion did mention this towards the beginning of the presentation, the Novartis COVID-19 Community Response Fund. This one's also accepting applications on an ongoing basis, and that information can be found at Rural Health Info. All right, we do have a couple of questions, so let me just pull up that list and see what we got. One question was, Marion, can you explain why some funds are considered inactive? I want to say you said that there was 9 active funds and 66 inactive. What exactly do you mean by inactive?
Inactive funds means that they are currently not accepting applications. There may be multiple reasons for a fund to be inactive. Sometimes it's simply part of their annual acceptance plan. Some funding sources take applications periodically, then review them, make announcements, and they close. They don't accept anything after a certain date. When you look at state and federal funds, they are often inactive because they're waiting to determine what funding they're going to be receiving based on appropriations, either through the federal or state level, or they might also be looking to see if there might, some programs are periodically discontinued. So you want to always check, because the landscape for funding availability changes frequently.
Thank you. Then if anyone has any questions, you can go ahead and just add those questions into the GoToWebinar panel. We do have a couple more. Marion, can you estimate how many hours it would take an organization to complete a grant?
It's going to vary by the grant. Typically, foundations might take you just to complete everything, if you've done all the homework and you have your cost estimates in place and you have your research data in place. it might take you a week to do a really competitive proposal. If you're looking at something like a pretty heavy lift, like a distance learning telemedicine application, I would say you might be looking at, maybe 2 weeks for that, just pulling it all together. Federal programs are required to tell you how long it should take to put something together. They have, an estimate that they publish. But I would say realistically, you want to plan in advance because the successful applications are funded by the work that's done before one word ever gets on paper.
And it's one of those things that if you're a minute behind the deadline, they will not accept it. Is that right?
It's absolutely the case, yes.
What
Absolutely.
advice do you have specifically for community health clinics and community mental health clinics on getting started?
Okay, I think the first thing that you really need to do to get started for both community health clinics and community mental health clinics is to assess, where do you feel you have a need? Right now, what are you hearing? Talk to your clinicians, talk to your stakeholders. What do you see as problems that potentially could be addressed by telehealth? And once you have a good idea of what some of those needs are, that's going to inform your next step. That's going to help you decide what type of project you need, and it's going to help you determine which funding sources are there. But again, start with determining your need, and then 2, be realistic about your capability. If you have a staff that's very tech savvy, they may be more comfortable working with telehealth. And I've actually heard from people who work at the federal level that there were definitely clients who got funding, and then the programs were not successful during the implementation period because they weren't really matched up effectively with the people who are the clinicians. Your clinicians are critical.
Perfect. Thanks so much. Looks like we don't have any other questions. So we'll go ahead and conclude the webinar. Marion, thanks so much again for participating.
I truly appreciate the opportunity. And Alex, you've just been wonderful. Thank you so very much.
Thank you. I've included our contact information here. So if you have any questions, if you would like any of those resources that Marion had mentioned, please email both of us here. So info@iristelehealth.com, as well as Megan@professionalgrantwriter.org. Also at the end of this webinar, once you close out of the window, there will be a short survey. It'll take you 45 seconds, probably shorter. Please complete that survey so we can make sure that we're providing as much value as possible with these various pieces of content and webinars. Thank you, everyone, and have a great rest of your day.
Thank you. And good luck.